Everyone should be aware of the 15 silent indications of diabetes that are sent out at night. Sleep is a reflection of your general health, not just a place to rest. Your body is using unusual symptoms at night to convey its secrets. Diabetes doesn't make a big show of itself. Did you know that? It flows silently beneath the surface of your body, like an underground river. Before the flow becomes a roaring flood, those overnight symptoms are the first ripples indicating danger. In this video, we'll unearth the 15 subtle signals that appear every night, indicating that something might be amiss, with diabetes most likely to be the cause. To identify every symptom and receive helpful guidance to totally change the way you manage your diabetes, watch through to the end. Let's get started. 1. A silent storm sending enigmatic signals. Night sweats. Your body should be in a relaxed and regulated state when you go to sleep. It's not a random occurrence, though, if you wake up in the middle of the night sweating. It can indicate that your blood sugar is falling too low. Adrenaline is released in these situations in an attempt to raise blood sugar levels. Abnormal sweating results from this process, which also raises your heart rate and activates your sweat glands. Furthermore, diabetes-related nerve problems may be connected to this phenomena. Sweat gland dysfunction can result from injury to the nerves that regulate them. Start by keeping an eye out for any possible underlying causes if you frequently get night sweats. Prior to going to bed, first check your blood sugar levels. Research indicates that stable evening blood sugar levels should fall between 90 and 130 milligrams per deciliter. Second, include a low glycemic index little snack before bed. A piece of whole grain bread with a little of peanut butter, for example. Additionally, to reduce excessive body temperature regulation, make sure your sleeping environment is optimal, with room temperatures maintained between 64 and 70 degrees Fahrenheit, 18 and 21 degrees Celsius. Finally, if this illness continues, seek medical advice. To determine your typical blood sugar levels over a 3-month period, or to monitor nerve function for possible diabetes consequences, a doctor might suggest a HbA1c test. Second leg cramps, which are a sudden, painful pinch that keeps you awake. An electrolyte imbalance, more especially a lack of vital minerals like potassium, magnesium, or calcium, which diabetes can alter, is frequently the cause of the abrupt, excruciating spasms. Peripheral neuropathy, a frequent side effect of diabetes, is another factor. Uncontrollable cramps may result from injured nerves in your legs, sending the wrong signals to the muscles. In addition to being uncomfortable, this seriously interferes with your sleep. Poor blood circulation, a typical problem in diabetics, can also cause leg cramps. Muscles may react with severe contractions when arteries are unable to provide the legs with adequate oxygen-rich blood, particularly at night when the body is not moving. Make sure your regular diet has enough necessary minerals to lower the chance of leg cramps. Increase your intake of magnesium by eating leafy greens, almonds, or whole grains, and include foods high in potassium, such as avocados, sweet potatoes, or bananas. To improve blood circulation, do some calf stretching exercises before bed. One easy approach to stretch your calf muscles is to stand about a foot or 30 centimeters from a wall. Put your hands on it and bend forward. Check your blood sugar levels and see a doctor to assess nerve or vascular function if cramping happens often. 3. The leg's never-ending dance is known as Restless Leg Syndrome, or RLS. This disorder is typified by an overwhelming desire to move your legs, which usually happens at night or in the evening. Peripheral neuropathy, a typical consequence of diabetes, has been found to be closely associated with RLS. Damage to the nerves in the legs might result in tingling, prickling, or excessive restlessness. This causes discomfort and seriously impairs the quality of your sleep, keeping you in a vicious circle of exhaustion. RLS is also linked to an imbalance in dopamine, a neurotransmitter that controls muscular contraction. Diabetes can have an indirect impact on the body's dopamine production and utilization by interfering with metabolic processes. Making changes to your lifestyle is the first step if you regularly feel tired in your legs. Before going to bed, stretch your leg muscles or take a short stroll to release tension in your nerves and increase blood flow. Increase your dietary intake of iron and magnesium, because RLS is frequently associated with deficits in these nutrients. Oats, cashews, and leafy greens are great foods to help relieve this issue. Additionally, since they might make restlessness worse, stay away from stimulants like caffeine and nicotine throughout the evening. 4. Sleep apnea, a breathing disorder. Sleep apnea is more than just short gasps for air while you're asleep. It is a situation in which the body experiences oxygen deprivation due to a temporary blockage of airflow to the lungs. Sleep apnea is more than a singular incident for people with diabetes or at risk. It can exacerbate general health conditions. The brain sends emergency messages to wake you up and restore breathing when the body is low on oxygen. This raises the possibility of blood sugar abnormalities by causing frequent sleep disruptions during the night. Additionally, increased insulin resistance linked to sleep apnea makes diabetes more difficult to control. Additionally, this illness may put stress on the heart, increasing the risk of hypertension and serious side effects like strokes. This risky combination further complicates the management of diabetes for people who have it. So, what ought one to do? First, keep an eye out for signs of sleep apnea, such as loud snoring, abrupt awakenings, or a nighttime feeling of suffocation. Changes in lifestyle are also essential. If you are overweight, you should lose weight since too much fat around the neck can obstruct the airway. Additionally, stay away from sedatives and alcohol in the evening, since they might cause the airway muscles to relax excessively, which raises the risk of apnea. 5th, Nocturia, frequent midnight urine, and the never-ending toilet trip. This shouldn't just happen at random. The kidneys have to work harder to filter and remove more glucose through urine as blood sugar levels rise. You urinate more often as a result of this process, even at night. You run the danger of electrolyte imbalances and dehydration, in addition to feeling exhausted as a result. Furthermore, nocturia is a common consequence of diabetes and might be connected to other problems, including kidney failure. Damage to the kidneys reduces their capacity to concentrate urine, which results in more frequent bathroom visits. The ultimate result is the disturbance of your natural sleep cycle, which results in extended sleep deprivation that impacts your general health and blood sugar regulation. Limiting your water intake in the evening is the first step towards reducing nocturia. To lessen the strain on the bladder, increase your water consumption during the day and limit it 2 to 3 hours before bed. Additionally, since alcohol and caffeine have diuretic effects and might exacerbate nocturia, stay away from them in the evening. See a physician to examine kidney function or the bladder to identify the precise cause if the symptoms worsen or continue. 6th, extreme thirst, an insatiable desire. The body uses thirst as a signal when it needs extra water to stay balanced. On the other hand, persistent thirst, particularly at night, is a warning indication of elevated blood sugar. As was previously indicated, frequent urination results from the kidneys having to work constantly to filter and remove excess sugar through urine. Additionally, the body loses water rapidly, which results in persistent thirst. If untreated, excessive thirst can exacerbate other symptoms and cause electrolyte imbalances. Moreover, it may be connected to the development of type 2 diabetes or persistent dehydration. The kidneys and circulatory system may be severely strained if the sensation continues, but it is the body's attempt to keep blood sugar and water levels in balance. First, drink water frequently throughout the day to make sure you're receiving enough, but don't drink too much at once. Spreading out your water consumption throughout the day is a smart way to keep your equilibrium. See a doctor to modify your food, medications, or lifestyle to better manage the condition if you experience thirst in addition to symptoms like exhaustion, dry mouth, or frequent urination. 7. Peripheral neuropathy, a silent electric shock, or limb pain or numbness. Leg pain or numbness, particularly burning, tingling, or a loss of feeling, is frequently not an isolated occurrence. It might indicate peripheral neuropathy, which is a typical diabetic consequence. Excess sugar damages peripheral nerves, especially those in the legs and feet, by interfering with nerve activity when blood sugar levels stay high for prolonged periods of time. Usually, the symptoms appear at night when your body is sleeping, but the nerves are not functioning properly. Without realizing it, losing sensation in your legs increases your risk of becoming hurt or infected, which can result in serious side effects like foot ulcers and, in the worst situations, amputation. Your sleep is also disturbed by leg discomfort or numbness. You should continue to be more active. To increase blood flow to your limbs, do some easy workouts like yoga or walking. Remember to take care of your feet every day. Look for any early indications of wounds, blisters, or infections on your feet. To prevent injuries to your feet, put on soft, well-fitting shoes. 8. The silent intruder in the night is hypoglycemia at night. When your blood sugar levels fall below normal while you're asleep, this event happens. The body releases adrenaline and other hormones to activate defense mechanisms when blood sugar levels drop too low. Sweating, a fast heartbeat, shaking, or even an abrupt awakening with a panic attack are indications of this. Nighttime hypoglycemia can cause severe consequences like seizures, unconsciousness, or, in rare instances, coma if it is not identified and treated promptly. Before you go to bed, check and note your blood sugar levels to avoid this. Make sure your blood sugar stays between 90 and 130 milligrams, which is a safe range. Include a light snack with complex carbohydrates or protein, such as a slice of whole grain bread with cheese, if your blood sugar is lower. Additionally, as directed by your physician, check and modify your insulin dosage or oral diabetes medication as necessary to prevent an excessively high dose that could result in hypoglycemia at night. Additionally, to identify low blood sugar while you're asleep, use a continuous glucose monitor, or CGM. When your blood sugar falls to dangerous levels, this device can send you an alert so you can take immediate action. 9. The battle with the night, insomnia. Tossing and turning in bed every night is not the only symptoms of insomnia. Instability of blood sugar is one frequent cause. The body responds by releasing stress chemicals like adrenaline when blood sugar levels rise or fall too much during the night, which keeps you awake and keeps you from falling back asleep. Insulin resistance is also associated with sleeplessness. The body creates more cortisol, a hormone that elevates blood sugar and decreases the effectiveness of insulin when sleep is disrupted frequently. This leads to a risky cycle of uncontrolled diabetes and inadequate sleep. Keeping a regular sleep schedule is the first step towards better sleep. Your body can develop a stable circadian rhythm if you go to bed and wake up at the same time every day. Before going to bed, make sure your blood sugar is within a healthy range by checking and controlling it. Overnight, blood sugar stability can be achieved with a light snack that contains complex carbs, such as chia seeds or whole grains. Additionally, refrain from using electronics for at least an hour before bed. If the issue continues, you might need to have sleep function testing done, or think about treatments like taking melatonin pills or changing your lifestyle. 10. The nighttime blazing flame is acid reflux. GERD, or gastroesophageal reflux disease, is a disorder in which stomach acid refluxes back into the esophagus, causing discomfort and a burning feeling in the chest. It usually happens at night. Autonomic neuropathy is a typical consequence of diabetes that is one of the main causes of reflux. Food stays in the stomach longer due to this problem, which also makes it harder for the stomach to contract and empty, which puts more pressure on the lower esophageal sphincter and causes reflux. Blood sugar swings are more likely when the digestive system is disturbed, because it affects how well sugar and diabetic drugs are absorbed. Making dietary changes is the first step in reducing this occurrence. Steer clear of foods that cause reflux, such as chocolate, caffeine, alcohol, spicy and fatty foods, and so on, especially at night. Rather, choose lighter, high-fiber meals and consume them at least 2 to 3 hours before bed. Because of the way the stomach and esophagus are naturally constructed, resting on your left side can help lessen reflux symptoms. You should also raise the top of your bed by 15 to 20 centimeters. Additionally, it's critical to maintain a healthy weight because being overweight puts more strain on the lower esophageal sphincter. You could require drugs like proton pump inhibitors or PPIs if your symptoms increase or continue, or you might need to have a stomach function test to rule out other problems. 11th, nightmares or vivid dreams. The horror movies of the mind. Nightmares or vivid dreams that are so powerful that they cause you to wake up unexpectedly. The brain becomes overstimulated, and your body enters a condition of stress when blood sugar levels fall too low or climb too high during the night. Dramatic dreams involving fleeing, being in danger, or experiencing intense dread may result from this. Furthermore, sleep disorders like sleep apnea, which deprives the brain of oxygen and causes stress reactions all night long, can occasionally be indicated by vivid dreams. Establishing a tranquil nighttime routine, such as reading a book, practicing meditation, or listening to soothing music, will help you decrease this by lowering stress levels and getting your brain ready for sound sleep. Avoid alcoholic beverages and stimulants like coffee in the evening. If the problem worsens, speak with your physician. To make the necessary modifications, they could recommend sleep function testing or evaluate the effects of diabetes drugs. 12. The silent thief in the night. High blood pressure in the middle of the night, normally. Blood pressure decreases a little as you sleep to give your body time to rest and repair. An imbalance in the body's regulatory systems, however, is indicated if blood pressure stays high or even rises over the night. Diabetes is frequently associated with harm to the autonomic nerve system, which regulates essential bodily processes including blood pressure and heart rate. Additionally, an increase in stress hormones, like adrenaline, which are frequently activated when blood sugar falls too low, hypoglycemia occurs, or increases unexpectedly during the night, can result in elevated blood pressure in the middle of the night. In addition to putting more strain on the heart, these variations interfere with sleep, which leads to exhaustion and worsens general health. Particularly when paired with diabetes, high blood pressure at night is also a major risk factor for complications such as heart attack, stroke, or renal failure. To reduce this condition, start by utilizing an automatic blood pressure monitor that saves data to check your blood pressure at night if you suspect problems. This makes it easier for you and your physician to precisely monitor changes in blood pressure. Because processed foods can raise blood pressure, cut back on salt and steer clear of them at supper. Additionally, avoid stimulants like coffee right before bed, because these might raise blood pressure and heart rate. 13. Unusual drumming in the chest. Palpitations, or the feeling of a rapid, powerful, or erratic heartbeat, frequently happen at night and might startle you into waking up. For those who have diabetes or are at risk, this phenomena may be related to anomalies in blood sugar levels and the cardiovascular system, rather than just being the result of stress or exhaustion. Furthermore, an electrolyte imbalance, which is prevalent among diabetics, may be indicated by palpitations. This sensation can be brought on by an imbalance in minerals like potassium, sodium, or magnesium, which can cause the heart to beat erratically. Moreover, palpitations during the night may also be a sign of cardiovascular illness or excessive blood pressure, two typical complications of diabetes. The first step in reducing and controlling palpitations is to make sure your blood sugar levels are steady before bed. A little snack that contains protein or complex carbohydrates, such a slice of whole grain bread with peanut butter, will help keep blood sugar stable all night long if it's low. Boost your diet's consumption of vital minerals, including potassium and magnesium. Foods that promote cardiovascular health and electrolyte balance include leafy greens, bananas, and almonds. 14. The squeaking sound in the dark, teeth grinding. Bruxism, or teeth grinding, usually happens at night and can cause headaches, jaw pain, or general exhaustion when you wake up. An imbalance in blood sugar is one of the primary reasons of teeth grinding. The body triggers a stress response and releases adrenaline when blood sugar falls too low at night, causing muscle tension and the compulsive habit of grinding one's teeth. Furthermore, autonomic neuropathy, a frequent consequence of diabetes, may manifest as bruxism. This disorder makes the jaw muscles more sensitive, which makes them tighten more during sleep. Establishing a relaxation regimen before bed is crucial to minimizing this phenomena by lowering tension and relaxing the jaw muscles. Teeth grinding can be reduced by relaxing the jaw muscles with deep breathing techniques, meditation, or a warm compress applied to the jaw region. Remember to maintain and examine your oral health. The effects of teeth grinding on your jaw joints and teeth might be lessened by wearing a sleep guard. 15. The agonizing morning greeting is morning headaches. Headaches in the morning result from the brain not receiving enough energy when blood sugar falls too low. Other symptoms like exhaustion, perspiration, or a shaky feeling frequently accompany this. Moreover, sleep apnea, a prevalent sleep condition in diabetics, has been connected to morning headaches. When the airway is blocked, the brain receives less oxygen, which results in headaches and exhaustion when you wake up. Moreover, electrolyte imbalances or dehydration during the night, which frequently arise from diabetes-related frequent urination, are also typical causes of headaches in the morning. Establish a comfortable sleeping environment to lower the risk of sleep apnea and lessen morning headaches. Before going to bed, stay away from stimulants like alcohol or sedatives, and keep the bedroom calm and cold. To lower the risk of dehydration, restrict excessive fluid intake in the evening, and drink adequate water throughout the day. Consuming foods high in potassium and magnesium, including leafy greens or bananas, can assist if you regularly suffer from electrolyte imbalances. These are the 15 silent warning signs of diabetes that your body may be employing at night. Despite their subtlety and ease of neglect, these small details can have a significant impact on your health journey. Diabetes is a reminder to be proactive, pay attention to your health, and act before it's too late. It's not a punishment. Begin now. Monitor your sleep and symptoms at night. Regularly monitor your blood sugar levels. Establish a healthy lifestyle by making dietary and daily habit changes. Most essential, if something feels strange, don't put off visiting a doctor. To ensure you don't miss any more crucial health ideas, please like, share, and subscribe to the channel if you found this video useful. If any of the symptoms listed apply to you, or if you would want us to discuss more diabetes-related subjects, please leave a comment below. You are not alone on your journey to health. I appreciate you seeing, and I hope to see you in the next video.